Good evening. It's Wednesday, December 1st, 2021. This is the Littleton Board of Health meeting. We'll start. We have a 7 o'clock discussion with a COVID-19 update with Mr. Jim Gareffi and Katrina Wilcox-Hagberg. Hi, Jim and Katrina. How are you?
Good evening.
Good evening. Jim, how's it going out there?
It's a little crazy. The cases just kind of exploded in the past 2 weeks throughout the district, and even in town here, they've bumped up too. And it looks like if the numbers hold through till tomorrow, that looks like a little bit of a down from the last 2 week rolling, but still pretty high. One of the things I noticed, Mike Zeldin had asked me to take a look at, what the severity of cases or as much as we could glean from stuff like that. And what I was able to find, this is the last 2 week rolling period, though there were lots of cases, there didn't seem to be lots of serious illness. I guess I would describe it mostly as congestion and cold and flu-like. Not that those aren't serious, but to the extent that it didn't appear to be reports of hospitalizations and such. So this past 2 week rolling period of time, probably 40% of the cases are coming from households. Again, multiple cases from the same address. So again, that's still the biggest source of cases, it seems, going forward. And that's not just in Littleton, but in all the communities. Household transmission still seems to be the big driver of cases. And again, it's whether it's happening in the household, whether it's having somebody else coming into the household. It's not terribly clear from that, but what is clear is that we start to see an address. If there's multiple people, you start to see the address again in subsequent days. Probably the biggest thing, the state has changed two things: the contact tracing collaborative ended its service to the Commonwealth yesterday. So they'll be working to finish up the cases that they have through the end of December, I believe. And then the Department of Public Health has changed the focus for contact tracing. One of which, and again, is it where we are happen to be in the pandemic? Much more people, many more people know what needs to be done if they're a case or if they're a contact. That what they're having us do, because now the cases are just local, they're having us essentially make one call and provide education. We don't need to be following up through the course of the person's either isolation or quarantine. They want us to prioritize those cases that have occurred within the past 5 days. So whether you tested positive within the past 5 days or whether you've been exposed in the past 5 days, they want us to concentrate on those cases. Essentially, the one call per case, provide the education, provide the information from the Department of Public Health on the guidance for isolation and quarantine, make sure that they have our contact information if they have follow-up questions. If there's multiple cases that want to address, they want us to kind of have deal with one responsible, their term, responsible adult in the household to provide that information. Again, do the education, then be available for questions and advice. When interviewing, the expectation when we're interviewing somebody is that the person who tested positive, will contact or notify the people they believe were close contacts. And again, if there's cases that, if a positive case doesn't feel comfortable doing that, then we'll try to collect that information and do that. In the cases of schools, the state wants us to collect those contacts and work with the school to make sure we can try to address those. Again, I mentioned not expecting multiple calls unless there's some kind of circumstance that requires that. And they didn't quite explain what that was, but again, education's really the push early on to get people to hopefully understand what it is that they need to do to help us stop the spread. I don't know if any questions on that. So again, we've hired one new nurse. We had a contact tracer that used to work for CTC start today. We're looking to hire probably 2 or 3 more contact tracers or nurses. I think we've got a couple of leads we're hoping to kind of nail down for nurses. One of the nice things about hiring nurses, I think they probably have a much better understanding of the medical side. So if somebody has a question, that it's not just here's the isolation, here's the quarantine information, they can probably kind of elaborate on those questions and the answers that they give. So I think they probably get a a fuller answer from a nurse than somebody who's just a contact tracer. And not to diminish that, because that's an important role too. But again, if we can have those be one and the same positions, then we would prefer that. So
Is the one phone call, is that actual communication, or is that one phone call, no answer, we don't try again? Or
so what again, the slides from the Department of Public Health that from the every Tuesday they have a Maven webinar for the nurses or Maven users, and the the information was, if you don't get them on the phone, make sure you leave the message that's detailed enough. We're also looking into a text system so that, if we can't get them by then, a lot of the phone numbers we see, we believe are probably, cell phones.
Yeah.
And so if we can, send a text message out to get that information to them, we'll do that too. So we have a demo with a company tomorrow to see about being able to do that.
oh, that'd be great.
Yeah. Because even when they go through the CTC cases, there's lots of notes in there that either people's voicemails are full, or they don't pick up their phones, or occasionally you see invalid numbers. So people aren't inclined to pick the phone up. It's unfortunate. I think we saw our first question on a message that I think came from Mass Notify, which was good. I wasn't sure how that was going to roll out, but we had somebody email us a picture of the text message, and the question was, is this for real?
Yeah.
And so, I did a little bit of research, and the language, you can go to the CTC website, and the language is very similar. But then our nurse, who must have seen this more than I have, recognized that it's probably a message from Mass Notify. So those messages are going out too.
Great. It's good to see that Mass Notify is working for people.
Yeah, what do they say? Over 1 million people have signed up for it.
Oh, good. Yeah, I didn't hear that.
So,
Does anyone else have questions for Jim?
Say my only question was with the state closing down their contact tracing, how is your office and your team feeling about it? But it sounds like you've already got a plan in place. You're bringing some new folks on board. So, and it sounds like the expectations of those contact tracers have dropped a little bit of how much work for each case that you see. So it sounds like you guys have got it in hand.
It's a little panic because it's been hard. We've been trying to hire people, particularly nurses, probably for the past 2 months, and haven't had a lot of bites. But with the difference now, I think in the contact tracing, I think we maybe feel a little more comfortable getting just straight contact tracers to help us with that. Again, our goal is to try to get the nurses if we can, but at this point, all hands on deck. So,
All right, good.
Mike or Gino, any questions for Jim? Gino, you're muted.
Mute.
There
Can you
you
hear
go.
me now?
Yep.
Yeah.
Thank you, Jimmy, for what you're doing.
oh, welcome.
I'm going to personally miss you. I don't know why you can't stay another couple more years.
Well, thanks, Jim.
Yeah.
Katrina, how are you?
I'm doing okay.
Any good news?
Well, Jim said it's a little lower this week. We'll go with that. All right, so let's look at the state. I'll just jump in. Across the state over the last few weeks, we have seen increases across most of these metrics. So the cases have increased. The 7-day average is now around 1,900 cases per day. That's definitely higher. Test positivity is now 5.14%. As of today's report, the 7-day average of hospitalizations has increased over the last couple of weeks, and we're now around 800 per day. And deaths are kind of went up for a little bit, and we're back down to the 9 per day level. When I go to that 5.1% test positivity, I think it's really important to recognize that last 7-day period included a 4-day holiday weekend. So like we experience every holiday weekend, we had this decline in testing leading up to and during the holiday weekend. So basically over the last week, there wasn't that many tests being conducted in our state. And then this is Monday. So we have a lag with the reporting coming back too. And so Tuesdays, minimal. So at this point, we're playing catch up like we are after every holiday. So when you look at that 5.14%, just recognize that that was the sick people who were definitely getting tested and the other testing wasn't happening. So we'll see, as always, we'll need probably another week to catch up to know what was going on. When we look at cases, all counties in Massachusetts are now classified as high community transmission areas, or continue to be, I should say. Middlesex County's rates are actually higher, as was the test positivity. So we continue to be a high community spread area per the CDC's cut points. The trends for age groups, this is as of last week's report, which is data through November 20th. So this is a week, a week and a half delay, out of date. But here are the trends by age group. The 5 to 9 and 10 to 14 age groups remain the highest, those with the highest case rates. But rates for all age groups actually started to trend higher over the last 2 weeks. So there's more spread everywhere for all age groups at this point. And then I wanted to dive into the hospitalization and death. There's more severe metrics for the state. So like I said, the hospitalizations have increased over the last few weeks. The majority of patients per the DPH website, the majority of patients hospitalized are not fully vaccinated. So about 1/3 of those hospitalized on the November 30th date were vaccinated. The other 2/3 were not fully vaccinated. Older age remains the main risk factor for hospitalization. So the older you are, the more likely you are. Hopefully that's not a contact tracer. The older you are, the more likely you are to be hospitalized and have these severe outcomes. There were 204 COVID patients in the ICU, and half of them have been intubated, and the bed occupancy remains challenged. Shall we say 91% of all medical and surgical beds are occupied, 84% of ICU beds are occupied. And that's not just from COVID. So COVID is definitely contributing to that. It's my understanding that COVID patients stay in the hospital longer, so the bed doesn't turn over as rapidly. But there's also staffing shortages, hospitalizations for other reasons, mental health visits have increased, and those take more time to move out of bed. So there's a lot of things impacting our healthcare delivery system, if you will. And then the average deaths has kind of bounced between 9 and 13 deaths per day over the last couple months. So this is holding steady. Those vaccines are still working to prevent the most severe outcome we have. So then when we look into some local data, so for the period ending, 2-week period ending November 20th, so that's the Saturday before Thanksgiving, Littleton had 63 cases, and that's the highest we have been for months now, almost a year. So that was a definite increase over the 14 cases we had in the prior 2-week period. And Jim provided you guys a count today of 52 cases for Littleton between November 14th and 27th. That's that 52, slightly lower than 63, which is great, but also remember that has that Thanksgiving holiday in there. So I'm not sure how that would impact things, but we do like that it's at least holding steady and if not rising again. But I do want to back out and zoom out a little bit just to give people perspective. When I show just that little bit of a graph, which is the last 6 months, kind of forget what happened last year. So this is the graph since the state started reporting 2-week case counts for municipalities back in August of 2020. And the 63 cases that we had ending November 20th is actually our second highest case count that we've had experienced in this time frame. The highest one was 69 on January 9th. So what we would hope with this holiday period coming up is that we can keep this, hopefully we go back down and not continue up from here. And this 52 cases that should be reported tomorrow is also among the highest number of counts. So we have more COVID in our town than we have experienced in recent months. And then if we look and compare to our neighbors, the left-hand graph shows the average daily incidence rate per 100,000 so that we can compare across areas. Littleton's average daily incidence rate was 46.1 per 100,000. That's the 2-week period ending November 20th. And that was again higher than the prior 2-week period. And all areas that we tracked actually have trended up in that same time frame. And then again, test positivity. So the number of positive tests over the total number of people tested, not people, number of tests conducted. Littleton's test positivity last week was 5.37%, not last week, ending the 2-week period ending November 20th, which is before Thanksgiving. So that doesn't even count the Thanksgiving decrease in testing. So this is actually the 2-week period leading into Thanksgiving. So our test positivity is above that 5% threshold. We're trying to keep it below, and that was in that same time frame as that 63 cases. So again, we need hopefully more tests happening so that we can keep cases down, find them quickly, keep them out of public. And then when we look at the 7-day incidence rates, so we can look at the CDC's community transmission metrics, both the state, county, and Littleton are all classified as high community transmission areas and have trended higher over the last 3 weeks. And then this is the graph for cases in the Littleton school system. This is actually this week. The orange bar is actually this week. So starting cases reported to the school as of this last weekend. So when we say there's 63 cases in the school, that actually corresponded to the 8 here and the 16 here. That was the same 2-week periods. There was 24 in the school during that same time frame. So this next reporting period tomorrow with the DPH will release that 52 cases will correspond to the 16 and 8 back down here. So slightly lower. But that's about 45% of cases were identified in the school. And then, so we're starting to get a little indicator of what happened over the holiday and this week in school. So we're maybe holding steady at this point. And cases were this week. So as of today, we saw them 3 in Russell Street, 1 in the middle school, and 2 in the high school. And then when we look at vaccinations, there's been a lot of improvement in these numbers with the 5 to 11-year-olds who have become eligible. And as of last week's DPH report, 77.2% of Littleton residents were fully vaccinated, and 14% had at least 1 dose or partially vaccinated. The average for Middlesex County, to give you perspective, is 72%. So we're actually doing higher than the average for our county, which is great. And then this last period, we found that 500 kids, 5 to 11, had gotten their first dose. So that's 63% of this newly eligible age group. And that was before the clinic data came in. It had happened on Monday. So on Monday, I believe, maybe Anthony can give us an update of the number of shots that went in arms, but I know there were a lot of kids getting first and second doses, and I saw a lot of booster shots happening, which is great. Great to see. And then moving into the public health messaging part of my presentation, continue to advocate for vaccinations. This helps us lower risk of infection, lower rates of infection, protect against severe disease. The Pfizer COVID vaccine is now available for eligible people aged 5 to 11. It's a 2-dose regimen, 1/3 of the dose that was administered to the other age groups. And as of November 23rd here in Massachusetts, over 141,000 kids had received their first dose, including the 500 here in Littleton. And millions of kids have gotten vaccinated in the US. So that's a lot of accumulating data looking at safety and effectiveness of these vaccines, which is awesome. Kids have not been spared by COVID, so there is reason to vaccinate them. Kids currently aged 5 to 14 actually have the highest rates of cases in our state, and kids can contribute to spread. And we've seen that with schools and secondary transmission that occurs in the household and activities that they participate in. We'd like to keep them out of quarantine. We'd like to keep them in school. So vaccinating them helps to protect their participation in those activities. And we are still learning a lot about the long-term health impacts of COVID. So things like long COVID and other lingering health issues. So the vaccines actually have been shown to help lower that risk. So if you don't get infected, you don't get long COVID. So I really encourage everyone, every parent out there to reach out to their pediatrician, a pharmacist, or a nurse to discuss any of your questions about the vaccines for your children. And I'm happy to report our school mascots are now vaccinated. And then the other thing that's a big change is this week, the CDC strengthened the recommendations for boosters. They now recommend that all people aged 18 or older who have received either their Moderna or Pfizer booster at least 6 months ago, or received their J&J booster 2 months ago should receive a booster. Looking at the state data today, approximately 25% of those 18 and older have received a booster shot so far. And as I discussed earlier, the hospitalizations, death, and those more severe outcomes that happen more frequently with age, only 36% of residents aged 50 and older have received a booster so far. So this is an area that could use some outreach and messaging. And these clinics hopefully will help reach some of those people. So I encourage everyone who would be eligible for a booster right now to go find one, go book an appointment. And then, of course, if you have not yet started your vaccination series, this is the best way to protect yourself against the severe effects of COVID and help lower your transmission and that for your household. So I encourage everyone to get vaccinated. And then, of course, we're going to end, we're hearing about the new variant and things like that, and we're going to learn a lot about it in the next few weeks. But just as a reminder, vaccines are one of our tools, and it's one of our important tools, but it's not the only tool. And we should continue to use a layered mitigation strategy so that testing, rapid tests, ventilation, staying home if you're sick or exposed, especially if someone in your household is exposed, you should get tested. Using masks in public locations. All these are tools that really help lower the risk of spread and help protect you and also those around you. So I really encourage everyone to keep layering up your strategies right now. And that's it for today.
Thank you very much. Does anyone have any questions, comments for Katrina? Mike, Dan, Gino? No? Thank you, Katrina. Yeah, we'll see what we hear about the, yeah, go ahead, Mike.
I'm sorry. Was distracted with other stuff. I'd like to make a connection between some of the things that were noted by Katrina and her early data and what I'll call the folks who are, I don't call them not in high school, but I'll call them the 30 plus age group who are in the cohort that is, if they're the ones more likely than not, if they get infected with COVID, with the virus, they're more than 50% likely to either be moderate or severe. And what that means, and I'm only mentioning this, is important, I think, to think about this when we think about mitigation and going forward, is that it affects the major organs of the body, not just your lungs, but also the heart, kidney, liver. It's basically a pretty comprehensive assault made by the virus. So I think it's very, very important that we get the word out, especially to parents who are not in their 20s and have kids in the schools, that if they haven't got their booster shot, please get it. I mean, I just want to echo loud and clear that the danger to parents, the grandparents, the uncles and aunts who are not in their 20s is not insignificant. It's quite a significant threat. So not only should everyone in your household get vaccinated, but also you as a parent, as a in the family or visiting, whatever, if you're more than 20 something, get your booster.
Thank you. All right, so we can move on to our running a little late 7:15 public hearing on the mask mandate that's currently in place. We are one of 48 cities and towns in the Commonwealth with an indoor mask mandate. And does anyone have any comments on that to start things off?
Well, it seems like the school is willing to ask us if they can take the mask off in a class. That's the only thing I figure you have. So if there's any comment, then I can make a comment later.
Yeah, I wanted to mention I think it's definitely worthy of a discussion. Unfortunately, we didn't get the formal notice in time to get a vote on the agenda, but maybe since Anthony's here, he can guide us through the process and see if it might be appropriate for us to take a vote on the topic. But yeah, I wanted to discuss the letter we received from the school committee regarding mask flexibility and the conditions that Dr. Clenchey alluded to during the November 18th school committee meeting. I just have to say that I personally like the strategy laid out by the school committee. I feel like it will accomplish one of the most important tasks at hand, which is to entice more vaccinations, not only among the student population, but also in their households. And on top of that, I think the plan that they've laid out, it'll make more efficient the pooled testing program and bolster the participation rates. So, getting back to some of the conditions that Dr. Clenchey had alluded to, we've had some conversations, and I took the time. I don't know if Dave, if it's okay if I share my screen, but I put together just a laundry list of potential conditions that the board may want to talk about implementing with the school committee as partners. And I think the chair of the school committee, Matt Hunt, and Dr. Clenchey are on this call. And while I'm looking through the attendees, I do see a hand raised. So maybe we should take a quick public comment just on anything that was pertaining to the COVID-19 update. If Mary, Janet, I don't know if you want to.
Mary, will you state your name and address, please?
Hi, my name is Mary Philpot. I'm at 18 Hemlock Road in Westford. I'm a school nurse in Littleton Public School District, and I wanted to make a comment about the school application for the mask mandate flexibility. I'm actually hoping that the schools stay aligned with the town's mask mandate, currently in effect until January 15th. The number of positive cases in the school district right now has already reached the number of positive cases that we had all of last school year. And we're only at the beginning of the winter season. I've also been tracking the number of breakthrough cases at the high school. And so far, 50%, so half the positive cases at the high school are breakthrough cases. Now, I understand that a school that has reached at least an 80% vaccination rate can apply for the mask mandate waiver. But with 50% of the positive cases at the high school having been fully vaccinated, it just makes more sense to me for the mask mandate in schools to stay aligned with the town's mask mandate. I don't see why we should rush the max flexibility before January 15th, especially with Christmas gatherings and New Year celebrations coming up around the corner.
Well, thank you, Mary.
Thank you.
May I say something?
Sure, Gino, go ahead.
Thank you so much, Mary, for your thoughts. The question is, I'm a little older than you are, honey, and for some reason, the holiday, people get together and they get sick. I noticed in that many people, even at Thanksgiving, they got sick, and we are high sort of it. My suggestion would be if we just postpone it to January 18 after Martin Luther King's Day, and they will help only the Board of Health of Littleton, but I think it will help also the citizen in the area and also in the school. That's my suggestion. I know there is, even myself, I complain, why do I have to put a mask on? You know what? I still go distance and keep distance from people, maybe 3 or 4 feet. I wash my hands and everything. I got my mask all the time. And I tell everybody should have a mask. But the question is, give us a break and they will be okay. By January 18, after Martin Luther King, I think the the Board of Health of Littleton is going to consider maybe to give you guys a break. Thank you.
I see Matthew Hunt has his hand up. I think we'll just take this comment and then we'll move on to sort of a list I'd like to share.
Hey, Kevin.
Hi, how are you?
I just wanted to put one thing that Mary said in perspective, where she's saying that 50% of high school students have been the breakthrough cases. The reason that number looks at 50% is because 82% of the high school population is vaccinated. Therefore, you're only dealing with 18% unvaccinated. So you're actually having basically at least 5 to 1 that vaccinated students would be 5 times less likely to contract COVID. A lot of the data that we've seen is for that age group is actually even greater for that. So to say that it's 50%, it's not like they're even numbers that we're dealing with here. We're dealing with a much larger pool for the vaccinated students than we are for the unvaccinated.
So you're saying there's a greater chance of vaccinated people getting it just because there's more vaccinated people?
Correct. So there's going to be a greater number of vaccinated students just because
Understood.
a greater number are vaccinated. So just a point of clarification there. And of course, the only ones that would be participating in a taking masks off at this time would be vaccinated students per DESI's mandate or waiver that they've granted us.
Understood. Thank you.
Yep.
So I went through, there's been a lot of comments kicking around, not only by Board of Health members, but school committee members in regards to what conditions would look like if and when mask exemption is granted as per the DESI waiver. And so, Dave, I'm just going to try and share my screen here so I can pull this list up. I'd like to talk through this list. I'd like to get any comments, questions from the board, and then bring Dr. Clenchy and Matthew Hunt in to go over this list with them to see if they have any questions, comments, or concerns. Does that sound like an okay plan with everybody? All right. Can you see my screen? All right. So the mask exemption will be for a 3-week trial period, proof of vaccination required, parental consent required. Conversations that I've heard and had are about 100% active pooled testing participation for those that choose max flexibility. So the participants are basically identified after their test with a wristband as visible identification and get tested prior to removing their mask. Mandatory active pooled testing participation for those that choose to participate in extracurricular activities. All students and staff choosing max flexibility shall be tested prior to the start of the 3-week trial period to establish a baseline of case count. Should the weekly case count double for 2 consecutive weeks, mask will again be required. The Littleton Board of Health may at any time rescind the exemption should it determine there's substantial public health risk, and all other current mitigation measures in place remain in place. So I wanted to take comments from board members, see what thoughts are. Mike, why don't you start us off since you have your hand up?
Just want to add one thing to your list, and that is that the shall we say the beginning, assuming the preparations are all done in time, the relaxation or the variance or exemption in for the Littleton High School building itself would start on or around January 17.
And that's a holiday.
All right, we'll just move it to the 18th.
Okay. I mean, I know the school committee had asked us to vote on whether a December 6th through 23 time period would be acceptable by the Board of Health, and we'll, we should take that into consideration as we make our comments. Are you opposed to such a time frame?
I think it's not so much a negative. It has to do with the fact that school is part of not just the Littleton community, but also the community at large. And I'll throw in, just so we put this in perspective, we're still part of Middlesex. And if you look at the data that have been presented and made available to us by Jim through the state, we're not an island here. All the towns around us are showing very high community spread. In brief, this is not the time to run a trial, stripping away one, not necessarily the only one, but one of a major, shall we say, set of, mitigation measures designed to reduce transmission. And since it's a physical barrier that we're removing here, it works in, we'll say, to some extent in both directions, depending on the user, depending on the material and all the rest. I think it would be premature with such high community spread to ask students to basically say it's okay to take off your mask when you leave school. You enter a totally different, being fair, you enter a totally different world. However, the school is part of that world. And so I'd like to see if we're in better shape as a community at large in the January time period when the gathering of families and other groups and other kinds of activities that are even starting this week and will continue on are over. We have a chance to see where we're going. And there's also, as we have become used to the pandemic, there is the onset of the, quote, unexpected. So I think, I don't know what's going to happen, where we're going to be 2 weeks from now, much less in January. But at the moment, this is not the time, in my view. This is the time for the school committee and the staff of the school to basically use their already existing experience and muster, shall we say, all the components necessary to achieve the requirements that we've laid out here for, shall we say, a reasonable trial period.
Okay. Dan, do you have any comments?
I have two. One, certainly the December 6th start date that had been talked about at the school committee. I have a procedural concern that this wasn't for us to act tonight. The only way that could happen would be to act, basically for us to act tonight or call a special meeting this week, because it wasn't posted to the board or the agenda as an application for a waiver within the 48-hour time frame. At least I still have not seen the official request. I'm not sure if other members other than the chair have seen a request from the school committee. So from a procedural piece, I'd be a little bit concerned about granting a waiver of regulation, which is what this would be, without an appropriately posted public hearing, making it clear that this is a public hearing for a waiver of regulation regarding, and that's not how our agenda was posted. So procedurally, I'm a little bit concerned with that timeline. As a board member, I'm kind of in line with Mike that if we did the trial starting Monday and we were successful, we were kind of basically, this is the highest level stress. We have folks just coming back from Thanksgiving, which even pre-COVID is always a high infectious disease week. Everybody goes out, different places, different populations, and they bring it all back to schools. We then hit Christmas, same deal. So I'm a little bit concerned with, if it was successful, masks come off and numbers are flat and everyone's great, it's great evidence that this is going to be successful. My concern is that if it is not successful, the risks associated with a failed test are significant, and that would be my concern. Obviously, it is not the board's concern with keeping kids in schools as much as possible, but as a parent, I'm concerned. I want to make sure that we keep as many kids in school as possible. And even with the lower severity that we see in most of this population, Jim went through that, you're right, most of it's upper respiratory kind of stuff and it's fine. They're still out of school for 10 days. So every case, even if not sick, they're out of school for at least a minimum of 6 days if they hit both weekends, or a couple days more, depending on where they fall. That as a parent, that's a concern. As again, not being a member of the school committee, but looking at a school-based piece that even if they're not sick, they're still out of school for an extended period of time. And if we do have positive cases, if the trial fails or the trial has challenges, and we now have folks going back, hitting Christmas, as much as I know everyone is always going to be as careful as possible, it's going to be awfully hard having kids stay away from family members over Christmas break, or away from friends over Christmas break, or away from college peers who are coming back for Christmas break. I'm just concerned that if it's successful, great data. If we have challenges, we are setting ourselves up for a very, very deep hole that we can probably avoid. Pushing it off till after folks come back, we get a week or two of pool testing, screening. We're starting off with as flat a population as possible. If you're going to get sick over Christmas, you've gotten sick and you turned positive. And now we're back to hopefully a more background baseline Littleton community number, rather than what the numbers are at UMass or UNH that have now come back into town for Christmas and now we're hitting our schools. That's my concern with trying to do it with such a short timeline. Certainly we have, you've come up with a really good list here to start with some things. I haven't seen anything from the school as far as their plan of how they would hope to implement it. And that would obviously want to be for that short a timeline. I would love to see a pretty solid plan from them of how they would ever implement it on Monday and be able to discuss it. So.
Yeah, I think, we'll see if Gino has any comments, and then we'll bring Dr. Clenchy and Matt Hunt in and they can elaborate on that. Gino? I think you're muted. There you go.
It goes up by itself. Okay. As I say before, I think it would be better if we just wait until January 18th. And then let's see what happens. Then the board will get together again and we'll find out if it's okay to go without the mask for a while.
Okay. Janet, can you bring in Dr. Clenchy and Matt Hunt, please?
All right. How you doing, Kevin?
Good evening, gentlemen.
For those of you who don't know me, I am Matt Hunt. I am the chair of the Littleton School Committee. I believe Dr. Clenchy is on with me. I can't see anybody but Jim Greffy right now.
Yes, he's here.
Oh, good. I can't see myself. Good evening, everybody. I'm Kelly Clenchy, Superintendent of Schools.
Good evening. So I'm sure you just heard the conversation we just had. It seems like just a quick poll of the board, January might be a better time frame to implement mask flexibility. And I pulled up a list here just after conversations with some of you folks and some of our folks, and trying to bring everyone together to be prepared and put a plan in place to make this happen when we're ready.
All right. Thanks, Kevin. A couple things. I'm not sure. I think Anthony might be able to answer better whether a vote could be made tonight. I know that we've had a lot of talk back and forth on.
He'll point us in the right direction. He always does.
Right. I think that's one thing we can talk about. Obviously we'd like to get a vote going, whether it's December 6th or January, whatever. I think we're just looking to set a date so that we can plan accordingly. Just looking at the list that we have here, mask exemption will be for a 3-week trial period. Absolutely. Proof of vaccination required, parental consent required. Yep. I can't speak for the entire school committee. Myself personally, I'd like to have 100% active pool testing participation for those. That way we set a bar. We know what the kids are going in. We test them weekly, so we can catch things quickly. The extracurricular activities, I think, might be problematic just because that we have a different. Not all kids who participate in extracurricular activities would be participating in the pool testing, or would be participating in the trial period, because they may or may not be vaccinated. They may not get parent consent. So that one we'd have to talk about, and maybe Kelly would have some ideas on that. All students and staff choosing mask flexibility shall be tested prior to the start of the 3-week. Yep, I think that's to get the baseline. That's fine. Should the weekly case count double for 2 consecutive weeks, masks will again be required. Yep, to break the glass case of emergency, that's fine. Littleton Board of Health may at any time rescind the exemption should it determine there is a substantial public health risk. All other mitigation measures remain in operation. Kelly, as I'm looking at this list, the only one that I see that might be problematic would be the extracurricular activities. What would you say on that?
Yeah, I agree. I mean, we can't, and I've sent this in an email already. We cannot require students to be in our pool testing program for an activity that we currently offer. We can, however, require people, if they would like mask flexibility, to be part of our pool testing program. So that would be fine. So I agree with what you said, Matt. I do have a question about wristbands, and just curious as to the philosophy behind that. We do have an Aspen system that we would be using to track students, and I'm sure that wristbands that we would purchase, anybody could purchase. So I'm curious. I just hope that whoever made that suggestion doesn't think that it's foolproof. There could be wristbands on the black market very quickly.
Yeah, you'd have to switch up the colors.
Yeah, we're talking about a population of students that are at an age that are very creative.
Yes, I was probably one of those. Yeah, I think just more of a visual identifier to make it easy. People don't have a sign on their head. As you said, the students are very creative, and we just want to make sure it's a foolproof, nothing slips through the cracks way of verifying both vaccination and active participation in the pool testing. So something that happens post pool testing, that those students are easily identifiable, some way, shape, or form.
Right.
Yeah, and the other thing
I'll leave that, as long as there's an understanding there and you figure out a way to implement it.
Well, we can certainly figure out a way to implement it. I mean, we'll have a backup mechanism with our program that we use as well, and teachers will have access to that database. So that would definitely work. I am appreciative of the fact that there is some type of marker, for lack of a better word, every week, because one of the challenges that any school would have is to make sure the students that are actually registered for pool testing participate in pool testing. So it does act as another check mechanism. So we can certainly.
Yeah, I think it's important.
The other question I have, one of the bullet points, testing shall occur prior to commencement of the trial period. I'm assuming you mean pool testing?
Correct. So in my mind, and anybody speak up if there's another idea, but anyone who would like to choose mask flexibility, their identity is known, they're put on a list, and they're entered into, pool testing prior to, let's say this trial starts on the 18th. Everybody gets tested the week before. We have our base number, and then we start with mask flexibility, the beginning of the following week.
Okay.
That was
just so you know, we test our students at the high school on Mondays. So
Mondays, okay.
Well.
So is a Tuesday start? So they would get tested potentially. What's the date? all things being equal. So that Monday prior is January 10th. So you'd have to have like the full list of all people wanting to participate in max flexibility up and enrolled in the pool testing system by January 10th, get them tested on the 10th, get our baseline. And then, am I right to assume they won't be tested again until the 24th? Or are you going to test on the 18th, which is a Tuesday?
We're not scheduled to make up holidays, so it would be a week delay.
There's no flexibility there, Kelly, as far as we can't move.
Well, I can certainly request that. We kind of set a schedule at the beginning of the year with a company that we're using, so it's a matter of whether they can rearrange their staff for us. So that would certainly be a request that we would make.
Okay,
we'll make that request. So other than
I think that's an important piece, just the testing.
Yeah. I mean, because we're moving into this next phase, we would certainly, make a strong case to have that happen. And our pool testing program has been going really well. In fact, we had Desi come out and watch us on Monday this week because they wanted to learn from what we were doing. So, we'll do what we can, and I'll have some time to put that in place as well, depending on if that's the date, so to speak, that we're moving toward. The rescinding of the exemption is fine. The only question I have is we're looking at January 18th, which goes beyond your town-wide mandated mask order. So once that order is off, your responsibilities in this process would be different. Or purview, and I just wanted to point that out. It's not that we don't want you to continue as partners, but it would be different.
No, that's understood. Yeah.
I'm sorry.
Yeah, go ahead, Mike. I know you had your hand up.
No, there's a perception here somehow or other that there's all of a sudden the Board of Health disappears on the 18th. The Board of Health does have the ability, if it sees a public health benefit or looks at a public health situation, to request whether it's still unclear. Let me start from the beginning. It's unclear whether or not the townwide mask mandate will be, shall we say, released or modified or gone or continued by whatever January 15th or whatever date it's, shall we say, arbitrarily set. I don't know where we're going to be in the first few weeks of January. And what's going to happen afterwards, even just given today's situation and what's happened in the past. So it's not clear to me to make the assumption for this trial that come the 15th, when the date has been, shall we say, put in place to consider reducing the relieving the mask mandate for the town, that necessarily happens automatically. It really depends on the situation at the time, or shall we say, the situation leading up to the time. I just want to make it clear that this, shall we say, this, I'll call it trial period, is a trial period in and of itself in a certain context. And we can't be sure what that context will be on the 15th or the 18th of January. That's all I want to make clear.
Yeah, and I appreciate you saying that, Mike. I agree 100% with you. The only other thing, and I'm not sure whether the rest of the members of the Board of Health did see the attestation letter that I received. The Commissioner of Education reserves the right to take away max flexibility if he deems it's necessary as well.
Well, I would like it to be a big success, to say the truth.
Yeah, oh, for sure. We all do. We wouldn't be here tonight asking for it. We certainly feel that we're ready to take this next step. And as both of you know, we've worked together to take a look at these.
Yeah, I know this is an unfair question, but I have to give credit to your student body in the high school that's made an effort to, as it were, reach certain goals, and all the rest, and their parents. Is your sense that they're looking forward to this as a broader community to shall we say, pull this thing off together, as it were?
I can say, Mike, just looking at some of the comments we received from, we sent a survey out and we got some responses from some of the students. Many of the students asking us to, try to remove the masks. Just being very blunt, making, I guess, one thing that I never thought of, but apparently masks can cause acne and can make, which is very, can be a big deal for a teenager. But kids would saying, I feel bad about myself because my face is breaking out because of a mask. I like being able to, see the expressions on my friends' faces, those kind of things we're hearing. I have a son at the high school who is a member of the testing program, who is, fully vaccinated, who, is very excited to have an opportunity for a trial to see if we can kind of gain back some normalcy for these kids. I think it's a really great opportunity because we have a chance now to not only help these kids out and make their daily experience a little bit more normal, but I think this is going to encourage, other kids to join the pool test, become members of the pool testing. Oh, I'm fully vaccinated, but I'm not a member of the pool testing, so I can't participate. So we'll get more, I think we'll get more participation that way. I also think you might see some kids being like, well, now I have a reason to get vaccinated because, there are kids out there like, yeah, I don't really believe in the vaccination thing, so I'm going to hold off. Well, now they have a reason. They may be able to unmask and, again, return to a little bit of normalcy.
I sure hope so.
Dan or Gino, do you have any comments regarding Matt Hunt and what Dr. Clenchey had to say?
Would it be useful to have Jim chime in? I mean,
Oh yeah, absolutely. Yeah.
He's actually probably have seen as much, if not more, than the rest of us have seen around.
Yeah, Jim, please.
So I had a chance to talk to Dr. Clenchey about what kind of metrics might be used to do this. And we had a conversation about how difficult metrics can sometimes be. But I think we had agreed that things like testing would be really important as any part of removing masks, just so you can always have a surveillance system, no matter which way the experiment, if you will, go. So I think that's a really important piece of whatever you're going to do as far as the masks there.
Yeah, and I think the piece about the people participating in extracurriculars, I was told that Fitchburg, the person that suggested this, Fitchburg was doing this, and I think it's something that could be looked into just because they're optional activities for the kids. It's not educational piece, so to speak. So just think on that, I guess.
Maybe it's also possible that those extracurricular activities are an example of what I would call an opportunity to test. I hate to use that word, but opportunity to exercise a somewhat different approach to what are called group activities, period, in the context of this particular cohort of individuals. In other words, the participation in extracurricular activities basically encourages groups, as it were, to assemble. And I can't think of a better place to enhance, or shall we say, make sure that as many folks as possible are vaccinated and or tested in that setting as an example of what can be accomplished while you're putting together groups, while you're participating in groups. So I don't know what, shall we say, if the Board of Health working with the school committee can encourage this as not an insignificant part of the mask flexibility approach for the entire town. In other words, it's informative. If we have a method here and procedures here that turn out to be robust enough for us so that groups can get together and begin, quote, getting back to normal.
Dan, did you have a comment?
I think the other one was that kind of operational piece of it looks like a big project, but in many ways it can be relatively straightforward. Certainly from Dr. Clenchey's perspective, that it sounds like your compliance monitoring aspect of this was going to be teachers with rosters and that just seems really cumbersome. I admit, from a having been a faculty member, trying to keep track of just simply teaching and classes and homework and assignments and group work and all those other pieces, adding in going, okay, I have to also pull up my roster going, oh, you can be in a mask, you can't be, and then changing every 48 minutes for the next group going, you can, you can't. Having that piece of being every class for faculty, was there any other, again, the wristband, Kevin came up with, or, had brought that up from someplace else as simply a quick, easy visual identifier going, hey, where's your mask? And they go, oh, I got my bracelet. Great, never mind. Keep on going with my assignment or my project or whatever it is. What was the other tech? Did you have another plan of how to ease compliance and monitoring for this over the course of the 3 weeks?
Sure. I mean, the program that we use, the teachers use it for other things as well. So it's not a separate program. So they're going into, it's called Aspen regularly. When we look at the percentage of unvaccinated students and staff in that particular school, it's less than 100 students. So it won't take long for teachers to get to know who is vaccinated, who is unvaccinated through the use of Aspen. And hopefully that number will decrease with time as well. So we're confident that with the database that we established, that wristbands will be helpful as well. We should be able to do this. Teachers do have trepidation because it's one more thing that's added to their plate, so to speak, as they're working through COVID times with full classes again. But from what I've heard from staff, they're up to the challenge.
How are we going to enter? Are you going to be having the testing folks putting in real-time data for their weekly pool testing? Because I may be vaccinated, I may be in the program and everything else, but if I didn't get pool tested, then theoretically I'm out of the program for that week. Are you going to be doing real-time testing? And again, I get that piece of just it seems every week I'm basically having to reset my brain, going, did Dan Kane's kid go to get pool tested on Monday, and he's been for the last 2 weeks and he's been fine, so my brain says he's on masked, but this week he isn't because he never got pool tested because he got to school late or whatever. So I'm just like, I just want to make sure, is there a way of making this as easy as possible for the teachers as well as students and those folks who aren't necessarily teachers, the nursing staff, administration, other folks in the schools who might be able to do that, walking through the cafeteria going, hey, dude, or through the library, because the librarians, my guess is, are not going to monitor all 400 kids who are coming through their library in the course of a week going, yes, no, yes, no, yes, no. I'm just trying to figure out, I want to make sure we're successful, and also making sure we're not creating challenges that don't need to be there, how we can make this as successful.
We are going to collect data in real time. That cross-reference is essential in order to stay on top of what we're trying to do. So, I mean, is it extra work? Of course it is, but there isn't any way to simplify this, or we would have figured it out by now. And as we go through this trial period, we'll certainly learn as well, and maybe we'll figure out better ways to do things. But if you want to monitor over 500 individuals in a building, that does take extra time. And I think the check and balances that we're going to put into place will allow us to do that. So we're certainly going to strive for 100% accuracy, as we always do with everything we go into. So,
Ellie, do we think that, I'm just thinking, the wristbands would be an easy identifier. If a kid's participating in the pool testing program, when they get tested, they get the wristband for the week. We change it up every week, whatever the color is. Mm-hmm. Is there a reason we would be opposed to doing that? Another identifier, I know Brad is texting me right now saying that they use a phone-based system at Salem State where they show the screen to enter certain places to show that they're part of that they've been tested. I don't know if that's something we can look at. But
we can look into that kind of software. I'm not sure of the cost of that and on and on. I mean, as my previous comment is, we're going to learn a lot during the trial, and maybe that's something we can do. But we'll look into it. But there are no guarantees that we'll be able to have that by the time the trial starts. So, I mean, that might be a good way to do it as well. the wristbands are easily identifiable. And as we all know, if they're going to wear them for 5 days or 7 days, depending on when we do the testing and when we start, et cetera, we're probably going to have replacement bands for them as well.
Personally, for me, I think that there's no major objections to using wristbands, I think it would be easier for the teachers. And like I said, it's you get it when you get the test.
Mhm.
You don't have the wristband, then you expected to have a mask on.
Right.
Again, but I don't know. There might be something I'm not thinking of why that might not be a good idea. So,
yeah. Well, in the use of phones, I mean, we really try to limit phone usage during the school day with our students. So I'm just thinking about all the ramifications here. Our teachers make sure that they have procedures in place in their classroom so that the students are engaged in learning and not on their phones. So again, we'll talk to the staff. I'll think about it some more, and if Brad has some information about the software maker, we'll certainly contact them and get some more information.
Great. Well, thank you guys for being here. Thank you for your time. We will we'll talk a little bit more about this. And Anthony, I know we're going to take some public comment if there are any, but I just wanted to ping you on, see if what your thinking was on a vote tonight, if it would be something we can do procedurally under the public hearing mask mandate item on the agenda. We didn't receive the formal notice until after our agenda was posted, unfortunately. But it was called out at the November 18 meeting that the school committee was looking for the Board of Health to vote on a mask exemption. So what are your thoughts?
So I think you know the answer to the question. I think Dan said it earlier.
I had to ask you though. I mean,
yeah, Dan mentioned it earlier. Anytime you're taking a vote, you really need to be a little bit more specific in your agenda. It would have been nice that the agenda, even though it gets posted, if it's still within the 48 hours, you can make the modification to the agenda and ask the town clerk to repost the agenda. So in speaking with the superintendent today, I think that the notice, even though it came after you posted your agenda, it was still within the 48 hours. So keep that in mind the next time, because I think at that point, once the superintendent sent the request, or the school committee, whomever it was, then you could have made that amendment to the agenda and just reposted.
Okay.
Anything is something becomes a problem when somebody reports it. So, I would, something as major really should be spelled out on your agenda.
Thank you.
Can I ask the question? The agenda calls it a public hearing on the mask mandate, and instead of interpreting this narrowly, what we're doing here about the mask mandates, an exemption from the mask mandate as it applies specifically to the schools, perhaps there's a formulation we could come up with that is consistent with the public hearing aim, which is to talk about and make certain decisions about the mask mandate. And it's conceivable we could come up with a motion consistent with this that talks about rules concerning exemptions and not specifically, shall we say, narrow our focus, because I'm going to stick my neck out. It's hard for me to imagine, and maybe I'm dead wrong on this, and other members of the board will tell me, as usual, I'm wrong. But it's unlikely that we are going to be seriously considering exemptions or variances or escapes from the town mask mandate, which extends currently to the schools, until after the Christmas holiday, probably on or around January 15. So I was thinking of a motion that basically says that we're going to suspend or hold off considerations of exemptions until we have a chance to look at the data townwide on or around January 15th.
Well, I think that would pose a problem for the schools who probably need a lot of time to get all the wheels in motion to implement such a mask flexibility plan.
No, I'm thinking that this does not stop them from getting their plans in order. Okay. And as I was trying to point out earlier, I'm not trying to close a loop on this or catch it, but we don't know what the status of the town is going to be on the date that we hope we could start the trial.
Yeah, but I think we can lay down the best plans possible and then, cross that bridge when we get there.
Mike, Kevin, I think what we're really looking for, like I said, if you can't vote tonight, we would like a vote before the new year on giving us a date so that we can prepare. Now, in those stipulations, you pointed out that the Board of Health reserves the right to kill it at any time. But if you can give us a date, a target date to start this trial, whether it be January 3rd, whether it be the 10th, whether if you feel more comfortable with after Martin Luther King Day, what we're looking for is a date so that we can prepare. But like I said, if that is part of your stipulations that you have the right to suspend it, should we find out that Omicron is running rampant in Massachusetts or the case numbers are going crazy, then that would be something. But I think as the school committee, I think would like to have that date.
Well, I think you've heard tonight a lot of people say January 18th. We have one more meeting before the end of the year on December 15th. I think it would be appropriate for you to take this list, which we've all talked about, and unless there's any edits, back to your school committee meeting tomorrow night. Dr. Clenchey, I think, is on the agenda to report to the school committee about this meeting. And then, you can talk about the January 18th date. And as long as everybody's on the same page and all of these items on this list can be adhered to, I don't see any reason why we can't appropriately post it and take a vote to grant this mask exemption on December 15th to start on January 18th, all things being equal, pending some severe increase in cases or something like that.
I concur that, yeah.
Sound good?
Yep.
We have two public comments that I want to take, and then we put the conscom off for a long time, so we need to get to them too. Janet, is there anybody? I don't know who's first. But...
Matthew Ridge. Can you unmute yourself?
Hello, this is Matthew Ridge, 325 Great Road.
Hi.
Hello. I am a little worried here. We're vaccinating our kids, and I've said this in the past, we're vaccinating our kids at a rate and on a medication or vaccine that has not been thoroughly tested yet. With recent documentation that has come out due to lawsuits and a few other things, I don't know if everybody else on this board has read them or not, but they have brought some concerning issues into the light, which is one of them is that we have not been fully told the
true story.
Go
ahead.
The risks and of the final vaccine that we are giving our children at this point in time, especially the Pfizer vaccine.
Matthew, excuse me for 1 second. Is this related to the conversation that we've all been having here?
Yes, it is.
Okay.
Because we are giving our shots to our children now, and on the FDA website, they are actually saying that the documentation that has come out is actually showing that we have a larger adverse reaction towards younger children and women versus this shot. And I'm more worried about my son and children of ages 13 or 12 and under getting the shot. Adults can make a decision on their own. Adults have to give the authorization to the children. And honestly, I'm worried about what I've been seeing in the documentation. I would like to have the board before the next meeting read. I could easily give this documentation to anybody who requests it.
Yeah, send it over to Health at Littleton.
Okay, because this documentation is showing at least a minimum percent of people who have been vaccinated from December of last year to February of this year at a 2.9 rate of at a higher risk rate of fatality than actually the COVID itself was. As well as that, they showed about a 12% ratio of having adverse effects that were long-term. And for me, that is something that we need to take into consideration. I know we want our children vaccinated. I know we want this to be better and we want this to be taken care of as quickly as possible. But I'm worried about the all long-term effects of the vaccine, as well as those people who, as well, because it's something that we don't have a lot of data on, and data that is coming out now is honestly scary. And I don't want to say that we should stop the vaccinations, but we really need to look at what is going on ultimately, because.
Well, thank you. Yeah, please send over that information and we'll take a look at it and we'll address it at our next meeting.
All right. Thank you.
Thank you. Is there anyone else, Janet?
Let's have this information, then we'll discuss it.
Hello, Solomon Marini.
Hi, how are you?
Good. 149 Hartwell. Appreciate all the thoughtful discussion on how to implement the max flexibility at the high school. The one thing I haven't heard really a discussion about is sort of to Mike's point about we don't know what the future is sort of what are the appropriate conditions both in the school and in the community where this is the right path. Mm-hmm. With if we see case rates at where they're at now or where they were, the past 2 weeks, is that the right time where we're at the second highest rate we've seen during the pandemic, or is there another set of conditions that we want to use to guide our decision on when this is the right time?
I'll just really quickly speak to that. I think you're 100% right. We need to keep an eye on what exactly is the right time, but then there's that other side of the coin that, if we keep waiting for the right time, we may never get there. But I think that taking that baseline first initial test from anyone that wants to choose mask flexibility prior to starting the program to actually see, how many asymptomatic cases are we talking about? We may do this initial pool test and find out there's 40 cases in high school. And I think at that point, the Board of Health will take a look at it, and I'm sure Dr. Clenchey will just say, hey, this isn't the right time to start. I think that's an easy decision to make. And obviously we'll keep an eye on the case rates and the numbers in town as we come back from the holiday break. And I think giving that 2-week buffer, coming back from the holiday break, I think we're all very cautiously optimistic and hopeful that the numbers will be better. And that's my take on it anyway. Mike, you have a comment?
Just to add perspective on this, we were, and I want to thank Matthew, members of the school committee for letting us know some of the comments made by these I guess it was the school superintendent Hoppington, where they have run a trial, or they're running a trial at the moment, or maybe I think the trial for them is over. And as I think was correctly pointed out, and this is something to consider, is that at the Hoppington High School, the trial was actually run during the warm September to October, early November period, when people were not hurting themselves indoors as we're doing right now. So actually, I'm hoping against the data that when we reach somewhere around January, and again, I just don't know what the result, what we'll be looking at, that we'll still be in the period where people are congregating indoors a great deal more than they would be, let's say, September, October, early November. So I'd have to say that there's a lot that goes into making the decision or going forward to it. And I hope the school committee and the superintendent Clenchy are, shall we say, are paying close attention to what's going around them, as it were. So the conditions under which we enter it may matter more about the weather than anything else.
So I think that, there's a lot of wait and see, but we do have to make a plan for when it's time, and hopefully we are at a good spot community-wise with our numbers come mid-January to implement such a plan. So thank you for the comment. Is anyone from Conscom still here? Can we do our 7:30?
Yes.
Thank you, Dr. Clenchy. Thank you, Matt Hunt.
Thanks for having us.
Yep.
Again, I know I'm available the next time we want to see how things are going. Like I said, I'd love to get that vote in.
Yeah, I think we'll put it on our agenda for December 15th. But I don't see why there's not any reason why, unless someone on this board opposes right now, I don't think there's any reason why we can't, plan for a January 18 start date, as long as all the criteria can be met.
Okay. Thanks, guys. I appreciate having us on and giving us the opportunity to talk.
Yeah, thanks, guys, for having us on tonight. Kevin, do you want another official letter?
No, I guess pending your meeting tomorrow night.
Yeah. If you let me know, because I can certainly submit another one right away.
Okay, thank you.
All right, thank you.
I actually don't know who's on the conservation, so if you could please raise your hand in the chat room so that I know who to promote.
Hi, Janet. This is Chase. I think Sarah Seward and Carl Melberg are, or at least were here at one point.
Yeah.
I don't know if they're still.
Thank you.
Okay.
Yeah, yep. I'm still here for sure.
Sorry to keep you guys waiting.
No, we certainly appreciate that. We're used to running late ourselves.
Hey, Carl, if you can hear us, you need to actually click yes to be promoted.
And obviously Amy is here joining us as well.
Hi, Amy. So if you all are ready, we can, it was a 7:40. No, it's 7:30. Discussion for 5 Cottage Way. What's going on?
So Amy, I'm not sure if you want to start, but we certainly appreciate having this fact-finding mission. And it doesn't have to be specific to 5 Cottage Way. I think what we're trying to do, and my name is Sarah Seward, I'm co-chair of the Conservation Commission. I think what we're trying to do is to elevate the partnership that we have with Board of Health when we have some of these projects that are coming to us that have barriers of entry really for the homeowner, whether it be proximity to wetlands and such. So I think we're trying to understand how we as a conservation commission can work with you all, and what it means that if there's something that we have to add other parameters into the order of conditions, what that means for the applicant. Do they then come back to you as well? I know that Amy has had really good dialogue with Jim Gareffi and others. But so we had a meeting with specifically Five Cottage, and we thought it would be nice to just go ahead and have this type of conversation with you all. And I know that Chase and Carl are here to chat with you as well.
Is this the one on Fort Pond?
Yes.
Okay.
One of them. Yep.
Okay.
Sarah, do you want me to frame the technical issues for a second?
I think that would be great, Chase.
Okay. So really what we're looking at here is a septic system that has some, I think, technical challenges purely from a septic system standpoint, as I understand them. But what I understand better is the wetland crossing component of it. So really there's the way, at least I see it, and I don't necessarily mean to speak for the whole Conservation Commission, is that there are three wastewater discharge options associated with this site. One is a tight tank proximal to the residents. The second is a wetland crossing and work within the septic system itself. The literal pipes would be on the edge of the 50-foot buffer, but then there's a significant amount of work associated with the septic system, both in terms of the wetland crossing and the slope of the drain field that would be within the 50-foot buffer. And the Conservation Commission, the town has adopted a no disturb zone within 50 feet with certain exceptions to it. But one of the exceptions is associated with essentially the feasibility. Is there an alternative that's less damaging to the wetland? And then the third is really the third septic option would involve a wetland crossing, but then would be well away from the wetland crossing, and there's a stream crossing. And essentially, the issue that we wanted to bring up is that at least looking at options 1 and 2 from a purely conservation standpoint, the tight tank makes more sense. Now, I understand you guys have reservations about that, but then from a broader wetland ecological and health perspective, building this septic system immediately adjacent to this stream, this option 2, also has some real problems with it from a wastewater discharge standpoint. So what we've heard, what we understand is that the Board of Health has some real concerns about a tight tank, even though tight tanks have been implemented in other places. We have some real concerns from a conservation standpoint about the wetland impacts and building something immediately adjacent to the wetland, where frankly, we have some real concerns about wastewater, minimally treated wastewater discharge to this wetland when the system's new, to say nothing of down the road when it is no longer new. So how did I frame that, Sarah? Any other?
Well, I have one question. Chase, where did you hear that the Board of Health, maybe Jim, you can speak to this, but why would the Board of Health have a concern about a tight tank? And this is exactly why I wanted to have this conversation. The way it was put forward to us by the applicants was that there is a concern that people would perforate the tight tank and therefore wastewater would simply discharge, untreated wastewater would discharge from the tight tank. Who would do that?
And
if I may, it was also framed that the Board of Health could not approve a tight tank if there was a Title V system basically available.
Jim, is that true?
Both of those statements are true. We have had and have had people who have perforated their tight tanks because they realize that it's $400 or $500 a month to pump the tank because in theory, all of the water that goes into the tank needs to be pumped. Other things that happen, sometimes gray water, laundry waste doesn't always end up in the tank. So it's not the Board of Health so much. And I think earlier today I sent out a copy of the section of Title V that describes tight tanks. And the state code doesn't allow boards to issue tight tank permits for new construction and for situations where a Title V system could be installed.
Is this new construction or is it an upgrade?
In either case, regardless of whether it was new construction or not, there are a couple of exemptions for new construction that are in the code. I think the information I had sent you. But if there is a possibility of getting a conventional Title V system on the site, that is what the code prefers. And that's how it's outlined in that tight tank section is, if I can read it, approval of a tight tank may be granted only to eliminate a failed on-site system when no other feasible alternative to upgrade the system in accordance with 310 CMR 200 through 293 exists. So again, it's really directing the board away from tanks unless they're the only thing that you can do.
And where our conflict lies here is in this tight tank versus the system proximal to this intermittent stream is that it turns on the feasibility of the conventional system. And what we don't have an answer to is if we were to deny the permit under the Wetlands Protection Act for the conventional system, does that then render the conventional system no longer feasible such that they would have to go to a tight tank? Do you understand the sort of the way I think we're chasing our tails here, trying to come up with a coherent system that frankly works for applicants and works for the town. I understand. I don't like this system at all, but I also understand the applicant's frustration with what's the answer, regulatorily, who's calling the shots here?
Dan?
I mean, I'm feeling Chase's pain. I certainly in the past have sat on a board of health that both had Title V as well as we didn't have wetlands, but we did have floodplain, which are often overlapping. So how do you balance those different requirements for the same thing? So I feel your pain, but at least we were on the same board having that discussion of what makes sense. I don't think one trumps the other, in my opinion, again, not being town council. I mean, the conservation and wetlands protection rules are there for a reason and apply the same as Title V rules apply. I'm not sure necessarily one trumps the other. Certainly, if we can, it's hard, and joint meetings are always challenging, but when there are times perhaps, I think probably Jim can spot them pretty quickly. You got the easy ones that are nice and simple, and really it's a simple board of health issue, and it's not going to go before anybody else. There's not an obvious concern. This one, as soon as you looked at those plans, there were the concerns and the regulatory and the jurisdictional challenges pop right up, and perhaps there's a way that we can, whether it's joint meeting or those kind of pieces of work together to anticipate it. So it's not ping pong. Board of Health says this, conservation says that. Now I'm back before the health of the new plan and they don't like it. I mean, it's where we are, unfortunately, and perhaps, with Jim and the building inspector and those folks that maybe they can look for those flags right at the beginning of these cases and go, okay, how can we start together rather than, 3 hearings in, trying to pull us back together to be successful. Jim, do you agree or disagree with the piece of that both regs are intact, in place, have authority? I'm not sure. Is there a piece that's above others as far as regulatory authority or jurisdiction?
So I think it's a little bit more muddied, and I'll rely a little bit on Amy's expertise on the Wetlands Protection Act. So Title V and the Wetlands Protection Act are both state regulations. And I think the Wetlands Protection Act kind of acknowledges that a system designed under Title V is, I don't know what the exact term is, but considered protective or whatever the language is in the Wetlands Protection Act. I think there's a third set of regulatory application, which is a local bylaw, your local wetlands bylaw. So to me, that's really, where the jurisdictional hierarchy is, I think is probably more of a town council question. I don't really know that answer.
And can I ask another question, Dan? Because you raised a good point about the idea of sort of interrogating these things together, right? And looking at these plans together and working with the applicants together. One of our other concerns with this system is its proximity to this intermittent stream. And we've asked for the applicant to do a peer review because we're worried about discharge to this intermittent stream. And so there's a wetland crossing piece and there's some work within the 50-foot. That's a problem that we're worried about. But this discharge to the intermittent stream has these real long-term implications in our mind, or at least in my mind. And however, the system itself, the pipe closest to the intermittent stream is 50 feet from the intermittent stream. So I think that's another thing that we would have liked to have discussed with everyone before the system that was characterized as just barely catching a seam to meet our perk tests in this location before it gets permitted through the Board of Health. And so we could have some dialogue about the collective concerns here rather than, yep, it perked, we're good, and we go on.
Carl, I'm not sure if you want to voice any comments on that. I know we had referenced some issues with bedrock as well.
Could I ask a question of Jim before we get further? Because I'd like to catch up on something. Leaving the economics aside for the moment and leaving the tight tank aside for the moment, are there existing approaches and technologies that would address the issue for the applicant as well as the Conservation Committee that have in fact not been put forward as possible solutions?
So I've had conversations with Amy about, what could be done with these concerns. So maybe we should kind of take a little bit back up on septic systems. Every septic system that gets installed in town, gets installed in the ground, discharges, lightly treated, if you will, wastewater to the ground and into the groundwater, whether it's on Fort Pond or downtown or anywhere else in town. I understand the concern here. It's adjacent to the intermittent brook, but they essentially function in a similar way. One of the things I had suggested that might have been palatable, and from a public health standpoint, if we're looking at conventional septic systems under Title V and the board staying within its regulatory framework, is they do make treatment tanks. So they make a number of different tanks that essentially aerate the wastewater. And so what you get is a cleaner effluent that discharges to the surface of the ground. It doesn't clean up everything in the wastewater, but it does reduce the strength of the wastewater before it's discharged in the ground. So things like fast tanks or jet tanks or Singulair. There's probably 2 or 3 more that I'm not remembering off the top of my head. These take the place generally of the septic tank, of a conventional septic tank, and the wastewater then gets discharged into the pump chamber, which then goes into the leaching area. So those, from a public health standpoint, those improve the quality of the wastewater.
And to your point, Mike, we've pushed the applicants to perform a more comprehensive feasibility study here because in addition to different technologies, they own enough land that with a longer run of pipe, it would still cross the wetland, but with a longer run of pipe, there's a high likelihood, still need to be perked, I believe, but I may be speaking out of turn there, that it would, a conventional system farther away from this wetland would be viable. Now, it would be more expensive, but one of the pushbacks we've gotten is, well, we've got a Board of Health approved system in this location. We're not doing a feasibility study to look at these alternatives.
Chase, can we have Amy just clarify what that system would be upgrading, because it would involve a significant crossing of another wetlands?
Yeah, and Sarah, I do recall this, and we did ask him if he could run the pipe to go up.
Yeah.
But you would have to impact a secondary wetlands as well.
Yeah,
right.
I'm not sure if Amy has any numbers for that, but it's.
So this is a situation where, like, if we had you guys there and we could have a conversation, like, it might have ended up.
Right. I think Jim brings forth really prominent conversations about the pre-treatment plans. And so I think that's why we want to establish a parameter of when you have already issued an approval, and yet we're still working on that. So if we were to come back and say, we would like to add a pre-treatment, I'm not sure whether you would call that a tanker or not, Jim, but then say, okay, so does the applicant then come back for just an amendment, or is it a whole nother review? So while we're talking about 5 Cottage, I think this is something that we're going to be talking about many times going forward.
Sorry, Amy, I didn't mean to cut you off.
Oh, no, that's fine, because I did also want to interject just to make it clear. The commission does not have a quorum here tonight. So this really is fact finding. We're not deliberating on anything, which is why we're also trying to sort of broaden the scope. And on the more remote septic system, based on the initial impacts that the applicant had looked at, it probably would have been more than 5,000 square feet of wetland disturbance, and they would have needed a variance under the Wetlands Protection Act to do that.
And my point with that was that in terms of broadening this, not necessarily that was the right answer, but rather that we've only sort of touched on some of the options and alternatives here that are viable solutions, in part because we've each been interacting with the applicant individually rather than collectively.
So it might make sense for the applicant to come back in a joint meeting, perhaps, and maybe present the idea of, a treatment tank prior to the leaching area, if the rest of it works for you guys. Dan?
From a procedural perspective, and so the question is basically Board of Health, you kind of have thrown conservation under the bus, that we said yes, that, and now it's you guys are being the bad guys and saying no. I speak for myself, but I think I speak for all of us going, that was never the intention. I think we actually pushed back pretty hard on them going, what have you talked to conservation? What has conservation's feedback and statements been? As I remember, we pushed back pretty hard about that because we recognized that this was cross-jurisdictional. I think, and we can, Anthony's still here, but I'm sure he's only in the background, but Jim probably with his experience as well, that again, the fact that we approved the plan from a Board of Health perspective doesn't necessarily mean it's, oh, well, we're good now. It still needs yours. And if conservation says it does not meet our expectations, well, then our approval of the plan doesn't mean anything because it needs both approvals. So they're going to have to go back to square one and go, okay, what do I need to do to get both approval? Because I can't build it otherwise. So I think that piece of, I feel bad. And it's always the who saw the applicant first often is the case. And, now the other board is the one going, yeah, that's great. I'm happy that they're happy, but we're not. It's a luck of the draw of whose meeting comes up first on the agenda. But I think from our perspective that it's not a closed deal. They may be pushing back saying the Board of Health approved it. So, well, you're stuck with it. You're not stuck with it. And I think if you say no, then it goes back and that's fine. I think that's the reason why we have folks go before multiple boards to make sure that we are crossing all of our T's and all of their different responsibilities and authorities.
Sarah?
Yeah, if I may, I have to say that, and I think we all appreciate this dialogue going back and forth. Conservation very much withholds approving any of the applicants prior to your approval, because we try and develop a relationship with them and say, if you don't already have Board of Health, you don't want to close with us because then you're going to have to reopen that again. So we have a different dialogue that many times we are waiting, and we encourage the applicant not to close off with us in case you do have a last minute change. So going forward, I think it's all our wish that we can somehow be a little bit more collaborative on some of these tricky ones, that we can say, maybe we should just do some joint meetings on a regular basis. This is the first. I've been on the commission a long time, and it's pretty rare for us to do this, but it's appreciated. Amy?
Yeah, and I would also say 99% of the time, obviously, it does not rise to this level. And quite frankly, Jim and I will kick some stuff around, and I'll ask him if you guys have approved something, or her ask me the opposite, and And, you know, we can usually handle it at the staff level. But this one is a particularly sensitive area with potential impacts that obviously the commission's trying to sort out. And I think there may have been one other possible design element, Jim, which I don't know if is a good thing or not, is the extra barrier between the wall.
So we had discussed the use of barriers and retaining walls. The board has seen a number of plans that have barriers on them, this poly barrier, usually it's 40 mil. And typically the barrier is used to make sure that storage doesn't mitigate horizontally because you've cut down the amount of fill horizontally, generally because you're bumping up against a lot line or property, another structure. So barriers can be used to prevent storage from migrating horizontally. Unfortunately, it still goes into the ground. And I think that's probably the bigger concern. I think, if I'm hearing it correctly, is wastewater getting into the groundwater at some point in time and then getting into the intermittent stream and thereon down to the pond. So the barriers are good for.
I'm sorry, perhaps I wasn't. I'm sorry, I wasn't.
You're breaking up, Chase.
All there, Jim.
We're missing all of that, Chase.
All of it, yeah. Sorry, you're all broken up.
Former the lateral.
We can't hear you, Chase. Oh, he muted.
Yeah.
If you guys can still hear me, my concern was. Sorry about that, guys. Can you hear me now?
Yeah, it was all broken up. We didn't get any of it.
Can you guys hear me now?
It keeps cutting out. So, Jim, were they proposing an extra barrier? Is that what you were getting at? Or?
Well, so with the breakout elevation, typically in Title V, you have to go out from the top of the piece down to the top of the system, or what's considered the top of the system, because it's actually the bottom of the system for Presby systems. And you go out 15 feet level at that elevation, then you're supposed to slope 3 to 1. So if you can't go out 15 feet, you put a barrier in. If you can't do the 3 to 1 after that, you put a retaining wall in. So it's a combination thereof. They can go out the 15 feet, so they don't really need the barrier. What they can't do, and that's what the design shows, and that's what they were in to see you were about, is they can't do the 3 to 1 because they're trying to keep that fill back from the intermittent stream. So what they did instead was put a barrier in. So, the addition of a barrier to that, I guess, would be more protective of the potential for horizontal flow and breakout, but it meets the state regs at the 15 feet already. So I'm not sure it gains a whole lot of additional, unless there was concern that the wastewater would break out at the top of the system, out of the wall, and come out on the wall there. So that's, in the scheme of things, it wouldn't do as much. I mean, if they were building the wall, putting the barrier inside the wall at the time, I don't want to say it's easy, because I've seen enough people try to do it and it's not really easy, but it's not an impossible task.
Yeah. And while they're there, they might as well do it, kind of a thing. Yeah.
Yeah.
Hey, this is Carl. The issue with this, and Chase laid it out really well, but it's from the septic system, it's all downhill. I mean, they found this very small area that perked among a bunch of non-perkable area, and everything else just goes straight down to the stream, intermittent stream, and then down to the lake. I mean, that's one of our major worries about about this particular system. The other worry is the potential precedent setting nature of this down in that area where most houses are not on septic systems. So it's we have several different, worries in our mind. Yeah, they did find this area that perked, but it's a very, very small area. It's just enough for the system to go in.
And was this the one where we had spoken, someone had made a comment that there was a neighbor also putting in a septic system, and there was a comment made about potentially them getting together to do a joint system, shared system?
I think that comment came up at the meeting, Kevin, and I think I probably said that, based on how challenging the sites are, I'm not really sure that's even feasible to do.
Okay. So Chase, I don't know if you can hear us.
Yeah, I can hear y'all. Can you hear me?
We can, but your last comment was all broken up, and no one could hear it.
Yeah, I apologize for that. Not sure what happened. All I wanted to note was that my concern was the lateral breakout, not the vertical discharge into the groundwater, but Carl captured it because the system is on such a steep slope.
Mm-hmm.
So if it was the lateral, if the commission was concerned with the lateral, then, a barrier placed inside the wall would add a level of protection. It's above and beyond Title V, but again, it's really up to the applicant and if they wanted to put that in there, if that was, something that the commission thought was significant enough to, again, I can't speak for the applicant. That's certainly something that could be added.
Yeah, I feel like if this is a plan that the Conservation Commission is uncomfortable with approving, then the Board of Health would take another look at a design that would meet your approval and our approval if this one doesn't work for you, given the requirements.
I guess the only thing I might add, Kevin, is everybody has their regulatory kind of systems to work within. And so I think joint meetings are good because I think you end up getting all the concerns out at once, but you're kind of balancing, we'll do this if you do that kind of thing. I think it's careful for the board to stay in their regulatory lanes, if you will, to the extent that those are instructive and descriptive.
Yeah, so
And that's a good point, Jim. My concern, and certainly I think we'll talk with the applicant next time we have a formal hearing, but my concern is I don't want to say to them, hey, we want you to put in a barrier, because frankly, from a Title V perspective, we are out of our lane by saying that. But what we may do is argue that they should do something else and come back and talk with you about alternatives.
But if those things mitigated your concerns, maybe that's part of the plan that you convey to them,
And they might be in the audience tonight too.
Yeah, are there any hands up, Janet? Two? I know, David, actually, he's been popping his hand up a few times, actually.
Yeah. You have two people with hands up. Are you ready for public comments now?
Yeah, I think so.
Okay. Oh, I'm sorry.
Hello, can you guys hear me?
Yep.
Hi, David Cowell. I'm a senior wetland scientist with Hancock Associates and representation of the applicant. With me tonight is Jacob Lemieux, who is our professional registered civil engineer who did the design here. And we do have some concerns, and we'd like to express those. One, again, I just want to go back to the alternatives analysis where we were discussing, whether or not there's a feasibility to push the septic system further up gradient and further away from the stream. And we provided an alternatives analysis that found that to be infeasible and impractical. If you look at the site plan, immediately beyond the leach field of the septic system as we have located is a steep gradient embankment that goes up slope. It's all bedrock. It would require blasting and cutting to get a pump system up gradient and across shagbark. And then immediately on the opposite side of Shagbark, as the Conservation Commission implied, there's a large wetland complex, and there would be far greater direct wetland impacts than the system we have proposed. You would have to cross that wetland several hundred feet to get to the opposite side to find anything upgraded. So again, we stand by our alternatives analysis. As it pertains to adders to a conventional septic system, such as a treatment tank or a polymer barricade, now we're talking about cost and whether or not that's necessary. We stand by the fact that we've met the Title V standard, that this is compliant with the Wetlands Protection Act, as Jim pointed out, that the Wetlands Protection Act states that any Title V compliant system is presumed to be compliant with the Wetlands Protection Act. If we could vacate any further than 50 feet, we would, but we meet that 50-foot standard. The hang up is whether or not the Conservation Commission will grant us a waiver from the 50-foot no disturb to get the line, the effluent line across. There's a temporary stream crossing where we'd put it and direct it up to the system. And I know the commission is saying that, I understand, I recognize that the water quality at Fort Pond is absolutely essential, and that isn't lost on us. The issue is that, or our concerns on behalf of the applicant, is that we've met these requirements and that it's cost prohibitive. I don't know what a pre-treatment system costs. My civil engineers have said that it's exceptionally expensive, and a polymer barrier. And at some point it becomes impractical that he simply can't afford this, that there's more. And this is beyond meeting the standard. We've met the standards for Title V. I'm not a civil engineer, Jacob is, but as Jacob explained this, is that by mounting the system is that the wastewater is treated before it enters the groundwater system. That's why you have set elevations above groundwater to afford that treatment prior to getting to the groundwater. And that this is, I mean, we can go down the rabbit hole and look at any other Title V septic systems in the town of Littleton that may be 50 feet away from a wetland. If it weren't for needing the waiver from the 50-foot bylaw to get the stream across, and we also offered a retaining wall, which has cost the applicant, again, significant expense to build that retaining wall. Initially, we had a conventional mounted system, but that would have entailed mounting in tree removal in the 50-foot no disturb zone. We've minimized that impact by putting the retaining wall in, and that was a significant additional expense. At some point, our client is concerned that by asking for more than what the regulations and even the town standards have for these systems, is that it becomes impractical from a budgetary context. So those are our concerns.
Thank you. Amy? Did you have your hand up?
Yeah, sorry, I just want to make sure we didn't get into very far down the trail of discussing the project and what can and can't be done, where we need to keep this kind of at a high elevation. So I didn't want to get off the road there, since we don't have a quorum right now. Thanks.
I think we have one more.
Yes. Vera Spore.
Vera, can you hear us?
You need to unmute yourself.
How's that?
Good.
Okay. I live on the pond and have for many years. And what struck me in your discussion just now is that you stated, and I think it's very true, that many of the surrounding cottages and houses have almost no septic system, have maybe a cesspool. I'm not sure. It's not very good on the pond. And it seems to me that people who have lived here for many years and respect and love the pond and are now trying to put in a system should be helped to put in a good system rather than hindered. And the Topianas have been on the pond for many, many years and want to do the best they can. it really seems to me that it's a bad example if others who don't have any system at all see that it is so difficult to put in something that is okay by all the standards. So I want you to consider that. I think it's important for lots of the cottages around the pond to put in decent systems and to be encouraged to do that, rather than to see that a decent system that has been thoroughly engineered is not being allowed through. Thank you. I appreciate being heard, and I appreciate what you're discussing.
Thank you.
There's one more hand raised, Jacob Lamal from Hancock.
Hi, can you hear me?
Yes. Hi.
So I just wanted to echo Dave's concerns and just bring up for the fast tanks and the nitrogen removal. I just think it's important to know here that even in a nitrogen sensitive area, the Title V limits you to 440 gallons per day per 40,000 square foot of area. The amount of area that we have available to us, even being in a nitrogen sensitive area, could support up to 3,000 gallons per day. So I'm not necessarily sure what, or at least if there's any way to really I guess enumerate or specify what benefit specifically these improvements would include, including the barrier being installed where we meet breakout distance. I think that some of these things are comfort items, which may not be necessarily completely understood, but just understood that it does something, so we want it. But I understand that we can't discuss that now, and I just wanted to have my say. Thank you.
Thank you. So I think for next steps is probably to schedule a joint meeting with the Conservation Commission, or how do you, Amy and Sarah, how do you want to handle moving forward?
Amy, I'll let you address that, because I think we are in uncharted territory with this at the present time. So the applicant is very much looking to go forward. We had at our last meeting encouraged to just wait and see what became of tonight with our fact finding.
Well, the commission's next meeting is December 15th. And that certainly hasn't been posted yet. So I don't know if you want to try to arrange something then, or
we have a meeting on the 15th as well.
Oh, look at that.
What are your thoughts, Kevin?
Jim, are you available on the 15th?
I'm going to be at your meeting anyway.
Okay. So maybe, and are you guys on Zoom?
Yes.
So can one of us schedule, maybe, will you come to our meeting and it be a joint? I don't know how logistically that all works.
I think, and I think because obviously our boards we're at the mercy of applicants at times to be on time. I think we would have to be the first on both agendas, so that we're not hanging up and Amy, I don't know if we've already listed the times for other hearings that night.
There's in the newspaper, the 7:30, yeah, 7:30, no, 7:45, 8, and 8:15 have already been advertised in the paper.
Can you add a 7 o'clock?
Yeah, we started.
We have a 7 o'clock. We have a 7 o'clock already.
What is that?
We could do a 6:50. Can we do right before?
I'm available if you are. I mean, it's up to Jim and Mike and Dan and Gino and Sarah and Amy. And the rest of the
Yeah,
council?
so we would have to, because we would need to have quorum, so it would be starting 45 minutes. And as it is, we've already changed our dates. We've historically always been on Mondays, so we're still kind of acclimating to Tuesdays. I think I'd like to ask Amy to poll the committee members tomorrow to make sure that we could have quorum to do that.
Like maybe I'll start with a 6:45 maybe and just see what people say and go from there.
Yeah, then Janet, maybe after we hear back from them, if there's a problem, we can try and shuffle something or, work something out.
Well, we have 3 members tonight, Amy. We could get a poll on us 3 to start with, and then.
Excuse me, Kevin, I think we have some stuff still left over from our agenda tonight.
We do.
Yep.
Okay, we'll let you all go, and we will certainly, Amy can get back in touch with Janet, and we'll go from there and look forward to a joint meeting sometime soon.
Yeah, hopefully on the 15th.
Okay, thank you.
Thank you.
Thank you all.
Thanks.
Appreciate it.
Thank you.
Thank you.
So moving on, we have the Board of Health vacancy. Is that what we're doing? I have to get
The joint meeting. Yep.
Joint meeting, December 6th. We have 3 applicants now. Janet, I didn't see attachments for the last 2 that came through today with a CV or a resume. Did you receive anything?
I did not, and so they came through Diane Crory, and when I asked her, she said there was nothing else attached, so I have not received anything.
Yeah, I noticed in the accompanying letter to the last one that came in today, the individual indicated that they sent the application materials to the select board.
I think they go both directions.
Yeah, that doesn't mean the applicant know. That doesn't mean the applicant ever knew it. So
yeah, I can check in with the select board tomorrow and see if they received any other information than what Diane did.
Yeah, they should have his resume if he sent it there.
Is there a deadline for applicants to apply?
It was noontime today.
Noontime today, okay. So did anyone have any other comment on that?
We'll see you the 15th.
So we have, do some administrative.
How many? So for our joint meeting on Monday night,
yes.
Can we do a quick poll to make sure that, or see who's going to be there? From what I understand, the process is each member of each board gets a vote. So it's not a majority of each or anything, that it's one person, one vote, and whoever wins.
Yep, there should be 9 of us in total. And I guess the majority will take it.
Yeah, fair warning. I've arranged, since I'll be at a distant post in Chicago, I've arranged to participate remotely. So we will be double hybrid.
To say that's the other question. If the select board is now meeting in person only, so how are we as a joint meeting? We are completely virtual. They are completely in person.
So actually, this is the chair, Mr. DeCoste, did approve a hybrid meeting. So there will be a Zoom link. So if you can't make it or are uncomfortable, we can participate that way as well.
Awesome.
Any other comments on that? All right. So administrative matters, we took care of the board vacancy. Any correspondence? Member comments? None, we talked enough. Public comments, is anyone?
Nobody has their hands up, but Kevin, I just received word from Amy that she misspoke, and the CONSCOM meets actually on Tuesday, December 14th. And I'm not hearing back yet. I think she's still gonna check and see if they can come to our meeting.
Okay.
They can do. Oh, sorry. Yes, she can do a 7:30 opening, so I'll do the 7. I'll put them on for 7:30.
Okay. And so we have a 7 o'clock and a 7.
Yeah, let me look.
7:30.
Was there a 7:15? Because we'll have to put the vote for the.
We have we have a 7 o'clock, then we have the discussion, your COVID-19 update discussion, and then the mask mandate discussion.
Wait. We got to be very explicit at that meeting, right? So it has to be very specific on the agenda, Janet.
I understand. I'm just trying to give timelines because we don't have a set time for those yet. So they have some wiggle room. So I think we can work with the agenda to figure out how to set them up to be pretty much right at 7:30.
Okay, great. The minutes for November 10th. Did everybody have a chance to read those?
I wasn't able.
I don't remember. I have to be honest.
I went back looking for them this afternoon and I couldn't find them in my email. So I may have just
Me
missed
too.
them.
Okay.
I didn't find it myself.
Janet, can you just resend those and we'll add that to the agenda for the 15th, please?
I annoyed Janet enough this afternoon. I wasn't about to ask again. So.
All right.
Great.
Oh,
So I guess
just one thing so that people know that I was assigned by the chair to have a brief debriefing with the individual who's running the holiday bazaar. And it turns out that the person, after in seeking help, consulted with Jim and had a further conversation with me. We sort of reviewed the various issues that could arise, and several approaches to those problems should they arise were discussed. But there's an awareness on the part of the Rotary Club director of the bazaar operation, of the holiday bazaar operation, of what has to be done. So I think we're as well prepared, they're as well prepared as possible in these, shall we say, uncertain circumstances. Crowd control in a day of COVID is interesting. Let's put it that way. Thanks, Jim.
Yeah, thanks for doing that, guys. All right. Well, I guess that's all that's left is a motion to adjourn.
Make a motion to adjourn.
Actually, before we do that, is everyone okay if I just send that list that I had up on the screen over to the school committee in preparation for their meeting tomorrow night?
Yeah, that'd be all right. Go ahead.
Yeah, so the only thing that kind of jumped out at me as a question was that doubling and doubling criteria to shut things down.
Mm-hmm.
I mean, maybe doubling the original number. I'm just like, if we had 4 cases to start, then week 2, if that means week 2 we have 8, and week 3 or 2, second round, we're up to 16 cases. I guess I'm just, that exponential growth, double and then double again in 2 weeks, seems like a pretty high/low bar, if that makes sense.
Yeah.
We could hit that. It would take a lot necessarily to hit that. And if we had in fact had exponential growth, I'm hoping we would have shut things down before we got to that.
Mm-hmm.
You know, because that's 5, 10, 20 cases in the course of really 2 weeks, 3 testing periods. So I'm not sure the best. Again, metrics are hard. It's art and science kind of piece. It's any number you pick. Okay, you're 1 patient over, but well, it's really not that bad, or 1 patient under. So I haven't met the criteria, but still going.
Yeah.
Concerning.
Yeah.
So I get it. I just that.
Well, we had
exponential break the glass number was kind of big. I'm with you. We had to pick something, and maybe it's double that original number. So if we start off with 5 cases, whatever, as our baseline. Okay, if we're hitting 10 cases on that, either week, if we're doubling that original number in either week, maybe. So it's not double and then double again. I'm just trying to think of something, because that, depending on where our starting point is, that could be one cases, 2 cases, now 4 cases. Yeah, we care, but if we go from 1 to 2 to 4, I'm not that worried.
Yeah.
But I've now broken that glass criteria versus 4, 8, 16.
Yeah.
Those are exact same numbers by that criteria, but those are very different clinical pictures.
Okay, so basically, if the base is 4, we only need 1 week's worth of doubling, according to what we're saying here right now, right? And then that's a signal that things should be brought to a stop. Is that what you're saying? If the base is 4,
right,
and it doubles in 1 reporting period, we shut it down.
Again, so using that criteria, my only concern is I'm not sure the right answer. It's just, it really depends on what that starting point is. If that starting point is 0.
No. Hold
well,
on.
I'm setting, so if we're looking for hard numbers,
I'm setting the starting point. If the starting point is 4, let's just say 4, and it goes to 8 in the next week of reporting, is that a signal to shut down?
It is.
Wait, just according to you, Dan. I mean, because that's the nice thing about having a base. We know how many cases we have. Clearly, if we had 5 to start and it went to 10, I think you'd feel comfortable shutting it down.
Right. So I mean, it's like you said, it's hard. Again, it's picking that number and where you start. You know, it's.
Right. Let's ask this question.
Well,
Dave, can I help?
What's our average cases?
No. Let's ask the question. What are we trying to accomplish with this variance? What are we trying to accomplish with the taking off the masks? What is it we're trying to do here?
What we're trying to do, I mean, we are trying to, I'd say we're trying to accommodate the will and wishes of the school committee to minimize mask use, to improve the delivery of education to Littleton students.
Okay, so
I think from our perspective, the only reason we're doing this, we're granting it on that basis. Our concerns, or my concerns with it, is at what point does the risk to citizens, residents, students overwhelm that potential educational benefit, and how do we balance that? That's where we are now. Masks are on because the Commonwealth and us say that the risk is greater than the reward.
Okay.
So,
but apparently the Commonwealth. I mean, I think we're working here with we're using the use of arbitrary numbers like 80% and others to make decisions. And I don't want to get into that box. And I think that you've hit it. I think the purpose of this is to improve education for the students as safely as possible. And the key word here is safe. So if they start off with a base of 4 and they go to 8 in 1 week, okay, are you more, if the base is 4 and they hit 8, do we shut down or we say, wait until they hit 16 or more?
I would hope we'd shut down before we hit 16.
Okay.
I mean, so, looking at our average weekly numbers.
So
I mean,
so you're trying to tell me 6 would not prompt you to shut down. Went from 3 to 6. You'd feel more comfortable somehow.
The average number of cases at the high school is 2 per week.
Okay. So let's just say, let's say we started so let's say their base is 2 and they double. We would probably not panic yet at 4, but at 8, we would say enough already.
Yep.
That trial's over in 3 weeks anyway, so.
Okay. So, okay. And the higher their base, the earlier, if they doubles, do we cut it off? It's simple. It's
yeah. I understand that.
That's what I mean, I understand, Dan, what you're trying to do, but it does depend on where they start from.
Exactly.
So if they start, so we have to tell them ahead of time, if you start with 2 and you double, we'll try not to interfere. If you start at 4, we may pull the trigger. If you start at 5, just hope you don't hit 10.
So, and I think using what their average number has been ties it to something that you have data for.
Yeah, exactly.
And it gives you some space to run.
Yep. I'm hoping they don't exceed 2. Let's put it this way.
Right. As we all do.
Okay, so let's agree here, at least among ourselves, that we're going to be looking at this from what their base is, and that's what we use as our start point, and we do the math from there.
Mhm. That sounds good.
Thanks for bringing that up, Dan.
No problem. I was thinking about today after I saw the list, that was, probably the only thing that just was such a variable. If they start at 0, well, then there's
can't double 0.
Well, now you know.
one to two. Those exactly of like where do they start, and that number could be 32, depending on what that happens to be. That week 1 number.
Right.
It was just that metric is just so loose.
Well, I've been asked the same question about Omicron, so don't. To me, this is child's play. Thanks a lot.
Gino did have a motion to adjourn.
I'll second it.
All right, roll call vote. Dan Kane.
Dan Kane, yes.
Gino Fratelloni.
Yes.
Mike Zeldin.
Mike Zeldin, yes.
And Kevin Baker, yes. Thank you.
Thanks a
for
lot,
everything,
Jim.